I'm Dr. Jennifer Singh. I'm an internal medicine and lifestyle medicine doctor. Today I'm going to talk to you about risky substances. When we talk about risky substances, we're warning against the harm of several different things: smoking, chewing, and vaping tobacco products, drinking alcohol, taking prescription medications over and above the prescribed amount, like opioids, as well as taking some of the things you might associate with risky substances like street drugs, cocaine, methamphetamine, and heroin. Taking any of these substances increases your risk of chronic disease and death. The impact can be far-reaching. It includes heart disease, cancer, lung disease, and mental health disorders. Beyond the harm that it can do to your mind and your body, there are negative effects on those around you. In particular, pregnant or breastfeeding women can cause infants to be harmed developmentally and behaviorally, having problems for years after they're born. What makes this a really difficult topic is that these risky substances are made to trigger hormones in your brain that make them feel great. That's why it's hard to quit. The other reason this is a difficult topic is that many people have shame and embarrassment around their use of these substances. This can make them reluctant to ask for help from a mental health professional, a counselor, or their doctor. We all have to realize that treatments take time. Different approaches work for different people. My patients whom I've helped quit smoking were often surprised to learn that people who successfully stopped smoking or using other substances sometimes had to try between 10 and 20 times before they successfully quit. This should be an encouragement to you if you are struggling with or trying to cut back or quit. Relapse can be actually a normal part of the journey. Patients may get discouraged when they have urges to drink, smoke, or use when they're trying to quit. But you should know that having the urges is normal, and it does not mean that you have failed. Even relapsing does not mean a failure. We also know that any reduction in usage can be a helpful first step. Think of quitting as baby steps. While going cold turkey can be one way to quit, and it does work for a lot of people, you should know that many people who successfully quit didn't go cold turkey. They started out cutting back in small increments. Some ways to do that might be deciding that you're going to have certain days of the week where you don't drink alcohol at all. It might be decreasing the number of cigarettes that you smoke every single day, or decreasing the days of the week that you use any substances. In treatment, it's often helpful to start with your why. Many patients find that they are much more motivated to do something for their health when they are thinking of their loved ones rather than thinking of themselves. Who would you like to be more available for? Who would you like to be a better version of yourself for? Is it your kids, your spouse, maybe your grandchildren? I have found grandchildren to be a powerful motivator for behavior change. Can you link wanting to quit to your love for them? Can that help you be motivated to cut back? And maybe thinking about your own health. What activities would you like to do when you are feeling better, less fatigue, and healthier? Next, most people who use substances have specific triggers. Many people whom I've helped quit smoking or cut back on their drinking could tell me exactly the time of day and the scenario where they were going to want to have a drink or a cigarette the worst. Maybe it was with their coffee or right after breakfast, or with a certain group of people who always tended to be the trigger for drinking certain types of alcohol. Learning what your triggers are can help you change or alter those triggers in ways that can support your desire to cut back or quit. Finding a mental health professional to help you quit can be powerful. Mental health professionals are familiar with helping people quit and cut back. You're not the only one who has ever tried to do this. They can offer tools like cognitive behavioral therapy or even medication to help you quit or decrease the side effects of quitting. This might include something like nicotine replacement or even anti-relapse medications for alcohol or opioids. In any case, the use of lifestyle medicine pillars like decreasing your stress level, exercising, improving your social connections, and improving your sleep will help in your recovery. If you've been using tobacco for a long time and you're concerned that the health damage has been done and it's much too late to quit, please know it is never too late to quit and improve your health. When you quit or reduce your tobacco use, significant health benefits occur immediately and for months and years after that. Anytime you quit, no matter how long you've been smoking in the past, you decrease your chance of lung cancer, congestive heart failure, stroke, lung disease, and believe it or not, infertility, which can be caused by tobacco use. Quitting immediately cuts your risk of having a heart attack by 50%. It can also reduce your risk of lung cancer by half after 10 years of not smoking. We often get this question, how much alcohol is too much? First of all, if you don't drink, don't start. Don't let anyone convince you that there are certain types of alcohol that are beneficial to your health and that you should start drinking them. 1 drink a day is considered 12 ounces of beer, 5 ounces of wine, or 1.5 ounces of hard liquor. Women are recommended to drink no more than 1 drink per day, and men are recommended to limit their alcohol consumption to 2 drinks per day. You should know, however, that alcohol is so closely linked to cancer formation that the American Cancer Society recommends 0 drinks as the safest amount. Alcohol use disorder may be described as using alcohol even though it's causing visible and obvious harms and problems in your life. If you've had problems in your life with alcohol related to your work, your personal relationships, the law, or reaching your personal goals because of drinking, you should seek help. If you're concerned about your alcohol intake, here are some tips. Start with your why. Get a piece of paper and write down who will benefit from you cutting back or quitting, and what else in your life will improve if you cut back or if you quit. If you're having trouble sticking to your goal, talk to your doctor. You can choose alcohol-free days or weeks. You can cut back on the number of drinks that you're consuming every day. You can ask for support from your family or friends. And remember, practicing those other lifestyle pillars, changing your diet, starting an exercise program, doing something to help your stress, and getting a good night's sleep can be great gateways to starting your journey to cutting back. Remember that trying to quit or cut back can be tough. Don't be discouraged if you've tried in the past and then started again. I can't tell you how many of my patients have told me, I tried quitting, I tried nicotine patches, nothing worked for me, I kept failing. They were so encouraged to hear that sometimes it takes 10 to 20 attempts before people successfully quit. And this gave them the motivation and the courage to try again. So don't give up.